Hello, my name is Alex and I am your Substance Abuse Wellness Facilitator. We would like to welcome you to the supplementary lessons. These will include additional information for you to identify any added performance inhibitors that may not specifically deal with illicit substances. For today's lesson, we will be looking at heart attacks and what to do in case it happens. Let's get started. A heart attack occurs when the flow of blood to the heart is blocked. The blockage is most often a buildup of fat, cholesterol, and other substances which form a plaque in the arteries that feed to the heart. The plaque eventually breaks away and forms a clot. The interrupted blood flow can damage or destroy part of the heart muscle. A heart attack, also called a myocardial infarction, can be fatal, but treatment has improved drastically over the years. Heart attacks are a leading killer of both men and women. Each year, more than 1 million people in the United States have a heart attack, and about half of them die. Half of those who die do so within 1 hour of the start of symptoms and before reaching the hospital. It's crucial to call 911 or emergency medical help if you think you might be having a heart attack. Certain factors contribute to the unwanted buildup of fatty deposits, atherosclerosis, that narrow arteries throughout your body. You can improve or eliminate many of these risk factors to reduce your chances of having a first or another heart attack. Heart attack risk factors include age. Men age 45 or older and women age 55 or older are more likely to have a heart attack than are younger men and women. Tobacco. This includes smoking and long-term exposure to secondhand smoke. High blood pressure. Over time, high blood pressure can damage arteries that feed your heart. High blood cholesterol or triglyceride levels. A high level of low-density lipoprotein, LDL, cholesterol, the bad cholesterol, is most likely to narrow arteries. A high level of triglycerides, a type of blood fat related to your diet, also ups your risk of heart attack. Obesity. Obesity is associated with high blood cholesterol levels, high triglyceride levels, high blood pressure, and diabetes. Diabetes. Not producing enough of a hormone secreted by your pancreas, insulin, or not responding to your insulin properly causes your body's blood sugar levels to rise, increasing your risk of a heart attack. Family history of heart attack. If your siblings, parents, or grandparents have had their heart attacks by age 55 for male relatives and by age 65 for female relatives, you might be at increased risk. Lack of physical activity. Being inactive contributes to high blood cholesterol levels and obesity. Stress. You might respond to stress in ways that can increase your risk of a heart attack. Illicit drug use. Using stimulant drugs such as cocaine or amphetamines can trigger a spasm of your coronary arteries that can cause a heart attack. Common heart attack signs and symptoms include pressure, tightness, pain, or squeezing or aching sensation in your chest or arms that may spread to your neck, jaw, or back. Nausea, indigestion, heartburn, or abdominal pain. Shortness of breath, sharp pain in the middle of the back. Cold sweat, fatigue, lightheadedness, or sudden dizziness. After a heart attack, quick treatment to open the blocked artery is essential to lessen the amount of damage. At the first signs of a heart attack, call for emergency treatment. The best time to treat a heart attack is within 1 to 2 hours of the first onset symptoms. Waiting longer increases the damage to your heart and reduces your chance of survival. Also, it is widely known and documented in many medical journals how a simple aspirin can keep an impending heart attack from occurring. Chewing up an uncoated aspirin and taking with water, not swallowing whole, can help stop a potential clot in the arteries before more damage has occurred. However, having a bottle of aspirin does not make you a doctor, so go ahead and call 911 anyway. If you suspect an employee is experiencing heart attack or the symptoms of heart attack, please ask them to immediately stop working and report the incident to your supervisor or the designated representative. Failure to do so could result in injury or even death. Remember, The best way to recognize any substance or non-substance performance inhibitors is getting to know the people on your team and being familiar with their characteristics. You have completed Supplementary Lesson 5. Please take a moment to complete the short Lesson 5 quiz and check out the additional resource section for more information. We'll see you next time.
Welcome to your SAW Field Guide. I'm Elena, and we're going to discuss some quick ways to recognize a problem a worker may be exhibiting. These are quick reference videos to help keep your job site safe and productive. Let's get started. The signs of a heart attack happening should be memorized, as quick action saves lives. If your worker is complaining of an aching sensation in their chest or a tightness, this is not a good sign. When added to other signs such as fatigue, shortness of breath, or lightheadedness, then you know you need to begin acting quick. Immediately call 911, and if you can, get them some aspirin. Aspirin helps to open up the blood vessels, which can greatly reduce damage done by the heart attack. Talk to your workers. See if their lifestyle may contribute to a heart attack, such as poor diet and smoking, and what you can do to help them better themselves, which will make their productivity so much better. Either way, if you think someone is experiencing a heart attack, it's best to ask them to stop working, call 911, and to report the incident to your supervisor or the designated representative. Well, that's it for this SAW Field Guide. We'll see you next time.